Hello, everyone. Welcome to another New Ask Fairer podcast. Today, we have two guests here, Dr. Edward Cheong and his patient Nancy. Thank you for joining us today. Dr. Cheong, can you introduce yourself and what you do?
Hello, I'm Dr. Edward Cheong. I'm upper GI general surgeon with more than 30 years experience, and my training was quite extensive in Cambridge and Norwich, and also in Europe, doing quite a few fellowships in Germany, in Netherlands, and then also in USA for over a year with Professor Jim Likutic and Blair Job. Those are my main inspiring mentors that taught me how to think about esophageal pathology and diseases and the surgery itself, whether it is keyhole surgery or endoscopic surgery with a gastroscope. And those are the things that helps patients, because we know that a lot of the early cancers can be treated endoscopically without major operations. And that's part of the organ preservations we tried. But that was not suitable for Nancy, because she had a much bigger problem that needed keyhole surgery, and that's how we treated her.
Nancy, what were some early symptoms you've experienced and how did that lead to your diagnosis?
Thank you for inviting me to the program. Essentially, there were two distinct episodes that led to the diagnosis. The first was in 2024 when I was in church, and I noticed that I took a lot more breath and effort in order to sing the worship song. So that was the first telltale sign. So even though there was no distinct pain, etc., but I felt there was chest congestion, and also the need to take in more breath for the worship song was a little bit concerning. So I went to see my GP, and my GP said that maybe I need to warm up my vocal cords before the worship song, or maybe I need to do more cardiovascular exercises to strengthen my lungs. So there was no major, suspicion. Yeah. And so that was the first telltale sign. And the second symptoms was when I was doing hiking in Australia. I realized that everybody was zooming past me while I was struggling to catch my breath up the slope. So I find that very suspicious. So when I came back to Singapore, I went to see my GP, and my GP said that, there's this Healthy SG program. Why don't you go for the chest X-ray, etc. And it was from the chest X-ray that I realized that there was a nodule which was of significant density that was picked up at the X-ray, and I was then advised to go for CT scan, etc.
So basically, the main symptom was really just breathlessness.
Yeah, breathlessness and chest congestion.
So then what were your thoughts and feelings when you first got your diagnosis?
I think I went through an emotional roller coaster ride, from fears, tears, anxiety, sleepless night, the whole gamut. I think whether it's a benign tumor or it's a malignant tumor, every patient will be exposed to the ups and downs of having a diagnosis like this.
Dr. Cheong, have you treated similar patients before?
No. So most of the time, this type of giant esophageal leiomyoma, they don't come every week or every month. This is quite rare. So we probably see it once every 10 years. But because I was working in a major tertiary center in US, yes, so we have treated this thoracoscopically or keyhole surgery to remove them. So it's not a surprise how to do it. But hers was unusually difficult because it was stuck to the lung, behind the heart, stuck on the diaphragm, and of course it was stuck on the esophagus. But there were also other little small satellite lesions that was surrounding the esophagus. So it was a surprise that we had other problems there.
Sounds like a really complicated surgery.
We had a very good team, from the anaesthetist to the OT nurse, who are a phenomenal team, to the support from all the industries who brought in the equipment for us. And also I had a good friend, a thoracic surgeon, Cunning, who helped me in there. So we were very prepared for the day, for whatever was going to come our way.
So, Nancy, how did you meet our dear Dr. Cheong? How did he become your surgeon eventually?
I think it is by God's grace that I come to know Dr. Cheong. I got to know him through one of my cell group friend who is also a doctor in KK Hospital. Yeah, so he recommended that I approach Dr. Edward Cheong. So honestly, I'm a bit kiasu. So when I was given the diagnosis, I went to see about 5 surgeons. 5, yeah, not 2, but 5 surgeons. But Dr. Cheong stood out among all the 5, and I must say that he is a surgeon who is in a league of his own. He is truly exceptional, and I think I could think of 3 reasons. First of all, is that he truly listens to his patient. Yeah, he's exceptional with regards to that. I think sometimes surgeons tend to be in a position that they know all, and they tend to shove the decision down your throat. And sometimes they could be in a rush to make the decision. But when it comes to Dr. Cheong, he listens and he understands. He takes time to understand your concerns, your fear, etc. And he's one doctor who goes beyond all measures and takes all effort to even like draw out how the surgery is going to be like, pre, during, and post surgery, how everything is going to be. So he gave me a lot of comfort. And I think he prepares me also very well for the surgery. His whole emphasis about prehabilitation, the importance of exercising, the importance of eating well. So I feel that I'm not just a patient, I'm treated as a whole person, and he's on this whole journey with me from day one.
From diagnosis all the way to the surgery, can you tell us what was your process or journey like?
Okay, I was diagnosed in October, I think. I was diagnosed in October, and the surgery was 30th of December. So it was quite fast and furious. Once I decided that I was going to go through the surgery, Dr. Cheong said that I have to embark on active prehabilitation, which is exercise. Thankfully, I also have a friend who is a yoga teacher, so she developed a comprehensive exercise program for me, like how I have to exercise, watch my heartbeat, how I have to maintain it at a zone 2 so that I don't tax my lungs when it's already having this tumor within me. I'm actively engaged in cardiovascular exercise, but yet ensure that I don't get into a situation. It's basically active exercise, healthy eating, and I think the other key component was that I'm very thankful that I have a huge community of people supporting me through prayers, through walking with me, etc.
How did it feel coming into Farrer Park Hospital? How was your experience here?
Honestly, I've never stayed at Farrer before. So this is my first experience, and I must say that it didn't feel like a hospital stay. It felt like a staycation. Yeah, so I would say that my stay here, I would call it SOS. It's not SOS for help, but it gives me a sense of serenity. Yeah, so SOS stands for a sense of serenity. The vibe here is just different. It's just very calm, very tranquil. And even the nurses here, they're not as stressed up or frazzled as the nurses from the other hospital. Throughout my stay here, even from ICU, I remember when I spent 5 days in ICU, I was grouchy, I was in pain, etc. So there was this nurse who came in and she says, "Shall I do your hair?" So she gave me a sense of being normal. She just came when you couldn't shower, you couldn't wash your hair for so many days, you're just grouchy, and that affects your recovery. And then she just came in and says, "Can I just do your hair?" And she just combed my hair and tie my hair. And I thought that was so sweet, not something that I expect from a nurse. Yeah, but she did that. So after the 5 days, I went into I was transferred to the normal ward. So the normal ward, I remember there was this particular nurse called Keddy. Yeah, Keddy was very, very cheerful, very fun. And he knows that patients on NG tubes, you can't eat normally, you may then be a little bit more grouchy. And when he come in, he will always say, "Okay, I'm your barrister, I'm here, and today we have this is your teh si kosong," or whatever. So he made the entire experience so much nicer. And the other thing is, I really, really enjoy the herb garden that you have here. Yeah, because I'm a nature lover. So being able to have some moments at the garden, feeling and smelling the plants and the trees just makes me feel better and makes me want to walk more, makes me want to get well much faster. So overall, yes, it is a place that is so good for people who wants to recuperate. And I would recommend any patient who is looking for a hospital to stay to come here.
Sounds like you had a great experience here. So then tell me, after your discharge from the hospital, how has your life changed after the surgery? Was it difficult to get back to your life or routine?
As a person, I find I have changed. I find that I'm given a new lease of life. So even though the tumor isn't malignant, it's just benign. To some people, it is just benign. But the whole journey makes me look at things differently. It makes me look at problems differently. It makes me appreciate my life a lot more. And I wake up with a lot more gratitude every day. And I'm thankful that I still have this surgeon who always asks me, are you still doing your walk? Are you still doing your walk post-surgery? Yeah, so the exercise, I still continue. I still continue with being very mindful of what I eat. Yeah, I still have a little bit of nagging pain by the side, but this is all part of the recovery process. Physically, I feel lighter. I think once the tumor was removed, I think I feel lighter physically and also feel lighter in my heart overall as a person. Yeah, it's like literally a weight off your chest.
So we know that this condition is rare. If she hadn't had surgery, how long might it take to turn from benign to malignant? And was it important to operate quickly?
Yeah, so when she first came to see me, I told her we got time to think and make the decision. It's not a cancer operation, so we don't have to jump on it tomorrow or next week. And the important thing is to allow her time, allow her family time to digest the information, to make a proper decision on what she wanted. Of course, I was not going to coerce her. I wanted her to understand what we're going to do and what the possible complications and the possible risks associated. But she was tremendous. She was amazing. I think she was like God sent in terms of her preparation. It really was. I was preparing her physically and also medically, mentally, and she ticked every box phenomenally. I was very, very, very pleased with everything that she does. It's fantastic. In terms of what she did, was not just cardiovascular exercises and the brisk walking and whatever exercise she did. She also ate healthy foods, and that allows you to heal better. Prehabilitation is one thing that I do very well, but you have to inspire them. You have to give them the information. You have to allow them to digest what they do, and you got to remind them what they need to do. And 99.99% of patients want to do well. They want to do well. And if they smoke, I get them to stop smoking. If they drink alcohol, I get them to cut back. If they eat unhealthy food, I cut back on the fatty food and oily food. And you have more fruits and veggies, which contains a lot of multivitamins and micronutrients that protect the body and allow you to heal better. If they need multivitamins, I give them the multivitamins, especially those with vitamin C, D, and zinc. It enhances your healing. So things that we do are quite simple and straightforward. They are doable. They're not complicated. So you have to have that big buy-in from the patients. And she was 100% bought, and she did everything with perfect marks. It was a very, very amazing. The journey was good, but like I said, I gave her time to absorb, digest the information, and to fulfill what she wants to do.
This prehabilitation concept, as a doctor, do you usually make a full plan for her? How does prehabilitation work and how do you apply it?
Concept of prehabilitation is not a complicated thing. It was thought of before, but unless you spend enough time with the patient, give them time to ask questions and what to do, and question why they have to do this or what they have to do, they're not going to have a buy-in. So time is important. I think a minimum time is 2 weeks at least. She had more than 2 weeks. She did everything well, and you keep it simple. Keep it simple to make it doable. If you keep it simple and doable, everybody can do it. And if you want to achieve big things, you have to prepare your patients well. One of the big things we know is, of course, the cardiovascular exercises. So the fast walking or brisk walking for 30 to 45 minutes, eating healthily, is important. If you have diabetes and it's not in control, control your diabetes. Cut out the sugar, cut out the bread, eat less rice, eat less pasta and pizza. So all the refined sugars, you just cut it out. Eat more fruits and veggies. And if you smoke, don't smoke. And if you drink too much alcohol, cut back or stop. The usual phrase I say it, to patients is, the operation is like an Olympic final. You cannot come in second. You come in second, we have a problem, you know. So you have to prepare yourself so well that you come in first every time. And the rest of the thing is, don't worry. Let me sort it out. So for patients who do good preparation and prehabilitation, it's a win-win-win situation for everybody, the patient, the surgeon, and the hospital, because it is very cost effective, because you have less wound infection, you have less chest infection, they recover faster, they go home faster. So it becomes very, very cost effective. They return back to their normal quality of life even faster. They are also counseled well so that mentally they're prepared, medically they're better, physically they're better. So overall, long term, they do very, very well. So diabetes is one of the things we control, high blood pressure, any other cardiac problems that allows them to have the operation safely.
So you're saying a good prep will lead to a much better clinical outcome.
Very much so. So that's why I say it's a win-win-win situation. You're not readmitted to the high dependency unit or intensive care with, let's say, you have an anastomotic leak or reoperations. It's a lot cheaper. So you do have a lower risk of anastomotic leak in patients who are fitter and better.
Dr. Cheong, could you share a bit about how you approached Nancy's esophagus issue?
Was quite a big lesion. So one of the big things is you need space to work. You need space to dissect. You need space to see the whole anatomy, behind it, under it, above it. And that was what was difficult initially, because it was all so stuck down. But as we took our time to dissect and safely, of course, protect the heart, the lungs, the diaphragm, and the aorta, everything that was stuck in the left chest, then it allowed us to see the anatomy clearer and allow us to progress faster in the end. But keyhole surgery is one way. Even if you do it robotically, it's also another way, but I don't think there'll be any difference. Definitely, you cannot do it endoscopically with a gastroscope, because this was all outside the esophagus, and because it was stuck to the heart, the lung, aorta, and the diaphragm. So those are too dangerous, and hence we needed to do the operation. And like I say, thanks, we had a phenomenal team that day supporting me, and thank God everything went to plan.
From a doctor's point of view, are there any big lifestyle changes after this surgery or key precautions the patient needs to follow?
The good news is we didn't have to change anything that we did. I think she's very motivated. She did more exercises, more walking, eat healthier, lots of fruits and veggies. So those are the things that really protect your GI tract, and that's important. If you left the leiomyoma alone and you don't do anything to it, it will just get bigger. It will rest on the heart and the lungs, and also surround the esophagus and create difficulty swallowing for her. That's one. Number two, there's always that worry that there can be a malignant change in that big mass. And I always quoted her, the figure is less than 1%. But we never know, because if it happens to you, then it's 100%. I can't give her that 100% revision is not going to turn.
So it's not something new to you in that sense.
No.
Like you can just go in and then know what to do.
Yeah, but every patient is different. Every anatomy is different. It's not like doing a small hernia operation in the chest. It's quite complicated, because your chest cavity is fixed, and any lesion of that is that size will press on the heart, press on the lung, it's stuck to them, and also stuck to the aorta. So those are the things that you have to be very mindful of, because it's not always easy to repair them if you have a complication. And I think by the grace of God, she sailed through this. I mean, she prepared so well. I can't thank her for her phenomenal preparation. Her family, her church friends that supported her, everything was fantastic. So that shows how important it is in the community, that it's not just between the hospital and the patient and the surgeon. There's a huge community out there that supports her. Therefore, if you think about it, if she had any major complication, the surgeon often feels like they have to answer to so many people after that. So it's a huge burden that I never want to think about, that you have to answer to them if something happens, so that there lies the grace of God. I think that's the best way to put it, because it's not how we do it. Complication does happens in every big operation. Nobody's perfect. But he was there supporting us every second in the OT and in the recovery and every day after she went home. So I do say thank God for all this. Thank you.
What is one piece of advice you will give to someone suffering from the same condition? Let's hear from Nancy first.
I guess I would say that for anybody who is experiencing fear of anything that you're experiencing right now, whether is it a rare condition, an existing condition, or whatever, I think first of all, it's very normal for you to go through a roller coaster ride in your emotions. It's okay, it's normal, and I think it's okay to sit with the emotions, and after that, take time and be gentle to yourself also. Sometimes we tend to rush and get very exasperated, like, how do I get myself out of this situation? What are the solutions, etc.? And then you get yourself into a frenzy. That was what I went through, I think. Yeah, but sometimes it is important to sit with yourself, be gentle with yourself, and also commit everything to the Lord and pray. And once you have that sense of peace, that is when you find that you are ready to embrace whatever life throws you, and have that village to go through life with you. I find that is so important. And be thankful.
Get all the information, like Nancy did, go and talk to a lot of surgeons. Get the time to feel that you're able to understand your pathology, understand the disease, and what type of operation you can do. Look for a surgeon that's capable and safe, someone who can really help you to get in and out of the operation. Look for a good team. That is very important. And like we talk about, prepare yourself for a big operation. So prepare yourself physically, medically, mentally, spiritually. Just prepare yourself and get everyone to support you. For this operation, she did everything. She did tick every box, and it was phenomenal, everything that she did. So I thank her for her success.
And I thank you too. Can I add a point too? That sometimes we should all learn to tune in to our body and listen to our body. So like for my case, I don't have significant pain. I don't have significant compromise in my function. It was just breathlessness and chest congestion, which sometimes we could think that it is stress related, but it was actually the telltale signs of my tumor. Yeah, so I think if we sometimes learn to pay more attention to what our body is telling us, that could also maybe help us to pick up conditions much faster. So not every condition comes with pain. The importance of tuning into our body.
All right, thank you to the both of you for sharing your stories. Thank you, Dr. Cheong and Nancy.
Thank you for having us.
Thank you very much.
Join us next time on Ask Fairer.